We are back on the record at the beginning of media number 4 of Elizabeth Holmes. The time is 4:03.
Ms. Holmes, did we have any substantive conversations off the record during the break?
No.
So I want to turn gears a little bit, and you can put that exhibit aside. But I want to change gears a little bit and now focus on Theranos' relationship with Walgreens. Why don't you tell us from the beginning sort of why Theranos was interested in engaging with Walgreens and conversely what your understanding was of why Walgreens was interested in partnering with Theranos.
Well, it had evolved over a long period of time. We were interested in partnering with Walgreens because of the retail footprint, and we understood that they were interested in partnering with us to bring lab services to retail.
Okay, so when did you first start discussions with Walgreens?
I don't know specifically. I believe it was in 2010.
Who were your contacts at Walgreens at that time?
So it evolved over a period of time, amongst others, and
And you said it evolved over time. Were there others who entered the mix after 2010?
yes.
Who else were you in conversations with at Walgreens after that date?
I know there was a team at Walgreens that was dedicated to working with us, and we tried to put a team in place on our side too.
Who was the main Theranos contact at Walgreens that you were working with? I'm talking about besides.
I don't know who the point was. Sonny was the point for our project team, and he had a counterpart at Walgreens. I don't know who specifically it was.
Do you know someone named?
I do.
Do you know what his role was at Walgreens?
I believe it also changed over time. I think we first met him when he was involved with construction in the stores. And then after the Boots acquisition, he took on a different role.
After the Boots acquisition, when was the Boots acquisition?
I don't know specifically. I want to guess in 2014, but I could be wrong. It might have been 15.
Was there a time when he became more closely involved in the Theranos-Walgreens relationship?
I think so, but I don't know. I didn't interface with him very much directly.
And you don't know who Sonny Balwani was interfacing with at Walgreens?
I know he did interface with. I don't know if it was his primary point of contact.
So, at the time that the 2010 contract was signed, was there a contract that was signed in 2010?
I think so.
Okay. At the time that it was signed in 2010, what did you understand that contract to provide? What services would Theranos provide, and conversely, what services would Walgreens provide to Theranos?
The original concept was that we would take our TSPU and place it in Walgreens stores to provide testing, and then try to bring other services like pharmaceutical trials and other things around it.
Okay. You said the original concept was to put the TSPU in stores.
Mm-hmm.
So at the time in 2010, I think you mentioned earlier in testimony that the TSPU was validated to perform about 15 tests. Do you recall that?
In the 15 tests were brought up in the clinical lab
Right.
in 2013.
But were being performed on the TSPU.
In the clinical lab.
Right. Is that your understanding? In 2010, that the TSPU was performing or was validated to perform about 15 tests in the clinical setting?
No, the CLIA lab didn't happen until after 2010.
Okay. So when you said previously in testimony that the TSPU could conduct 15 tests and was validated to conduct 15 tests, do you recall that testimony earlier today?
Yeah, I'm sorry if I didn't say it clearly. My understanding is there were 15 tests that were validated in the clinical lab, and then there were other tests that were validated in an R&D setting.
Okay, so the 15 tests that were validated in the clinical lab setting, then, that was your understanding as to the TSPU's capabilities to perform testing. Is that right?
No, my understanding was based on the work we did in the R&D setting and all the tests we developed and we thought validated, including on the TSPU.
Okay, and so what were the types of tests that you understood the TSPU was capable of performing? What were the categories of tests?
In 2013?
In 2010.
In 2010, by that time, we'd invented the architecture of the 4 series system, I believe, and so we thought that we could run a broad range of methods on it. I don't know how many of the 300 tests were validated at that time.
So now you just brought up the 4 series. So my understanding of your earlier testimony was that the 4 series was still in development and was not actually running tests at that time. Is that not correct?
Maybe I'm sorry if I don't understand the question. I thought you were asking about what we thought the TSPU was capable of doing in 2010.
Yes. So I think you earlier said that the TSPU was performing about 15 tests, was validated to perform 15 tests in the clinical lab.
We did, yes.
Okay. So now you're saying that there was the mini lab 4 that was also conducting tests?
So we developed a few hundred tests in an R&D setting and developed, and I'm using the word validated to refer to our understanding of how they were validated at that time. About 90 or so of them went on the TSPU, the 3 series version of it. The others were on other hardware platforms. Later, about 15 of those were into the clinical lab.
Okay, so there were 90 that were developed for the TSPU 3.5, but 15 were validated for the clinical lab, and the rest were on what devices?
I don't know off the top of my head. I'm not sure.
Were these analyzers that Theranos developed and manufactured?
Some of them, like for the nucleic acid testing, might have been. Some of them would have been the reference platforms.
The reference platforms, what do you mean by that?
Hardware that was originally manufactured by third parties.
Okay, so I think earlier you said that so let me just step back because I want to make sure that I understand this because it's an important point. So I want to understand what were the platforms that Theranos was using for clinical testing in 2010. I think we talked about the TSPU version 3.5.
So Theranos wasn't doing clinical testing in 2010.
Okay, so what platforms then did Theranos have ready to perform clinical testing at that time?
Our concept in 2010 was to take our TSPU through the FDA to try to get FDA clearance and CLIA waiver, which was what was contemplated in the original Walgreens agreement.
Right. Okay, but that I just want to go back to my question. So
Yeah.
what were the platforms that Theranos had ready to conduct clinical testing in 2010?
So the one we'd done, and I'm sorry I'm getting hung up on the concept of clinical testing. Just to be clear, we couldn't do clinical testing without either having a CLIA lab or an FDA clearance. So until you have those things, you can't do clinical testing. We had put a large number of assays on our TSPU 3.5, and we're planning on taking either that and or our 4 series platform into the FDA.
Okay, so there's a 3.5 and there's the 4 series platform. The 3.5, you said, Theranos had developed how many tests to run on that device?
That's the one that I believe there were ultimately 90 or so assays. I don't know exactly the number.
Okay, so there were about 90 or so that had been developed for the 3.5.
Yes.
Of the 90, 15 had been validated in preparation for clinical testing. Is that fair to say?
So I believe in 2011 we became certified as a clinical lab, and then in 2013, 15 were brought up in the clinical lab as laboratory developed tests. Or around then. It may have been in the few months after the opening of the clinical lab.
Right, and so I don't want to talk about CLIA certification or any of the regulatory approvals that you would need to get in order to put these devices in stores, but I wanted to focus on what the devices that Theranos had manufactured, what those devices were ready to perform in terms of testing. Okay, so the 3.5,
Yeah.
you said 90 were developed to put on the TSPU 3.5.
Yeah.
Of those 90, 15 were validated in preparation for clinical testing. Is that right?
Later, yes.
What do you mean by later?
As I understood it, you were asking about the 2010 timeframe. That work was specific to the clinical lab being live in 2013.
Okay, so the 15 had not been validated yet at that time. Is that right?
In 2010.
In 2010.
Not in a CLIA lab setting.
Okay, so only 90 had been developed at the time, but no validation work had happened yet in 2010.
So I don't know exactly when all 90 were developed. I know that ultimately about 90 were on the TSPU 3.5. We had done what we internally referred to as development and validation on the TSPU, which was to these FDA guidance documents as we interpreted them. And again, there's a separate process that is associated with validation of a lab-developed test in the clinical lab, which we had not done in 2010.
Okay. So then there's the 4 Series Mini Lab. So what tests have you developed for the 4 Series Mini Lab? How many tests?
Again in 2010.
Again in 2010.
Again, I don't know if or how many of the chemistries that we'd created we had put on it in 2010. I believe what we were mostly focused on then is demonstrating the ability to add these additional detection systems and essentially proof of concept of the additional capability of the mini lab.
Okay, so you're not sure as to how many tests, if even the tests were put on the mini lab yet,
Correct.
and you're not sure of how many tests could be performed if they had already been put on the mini lab.
Correct.
Okay. So what were the other platforms that Theranos was using or was planning to use for clinical testing besides the TSPU 3.5 and the 4 Series Mini Lab
In 2010?
in 2010?
As we saw in the emails, there may have been other multiple iterations of the 4 Series platform, but generally that was what we had intended to take into the FDA.
Okay, so there were other platforms that were similar to the 4 Series.
There were multiple 4 Series platforms,
Okay,
yes.
and what is your understanding as to what tests those devices were capable of performing?
It's the same generally across the 4 Series.
Meaning that you're not sure whether they could perform the tests or how many?
In 2010, I am not sure what tests we put on the devices or how many, if any, I don't know.
Okay. Were there any other platforms besides the TSPU 3.5 and the various 4 Series mini labs that you were preparing for clinical testing in 2010?
Our chemistries had previously run on open systems like the TCAN-like robots. I don't think in 2010 we were preparing for testing on anything except for these TSPU platforms that we wanted to get cleared for use at point of care.
Okay. So besides the TCAN devices then, was there anything else?
I don't know. That's what I can remember.
Okay. So as far as you know then, in the 2010 timeframe, there was one device that you know for sure, the TSPU, that was performing or that was capable of performing about 90 tests.
There was the TSPU, which ultimately we developed about 90 tests for. There was the 4 Series platforms, and there were other hardware platforms we'd used over the years in our laboratories.
Okay, but I'm trying to understand, out of all of the platforms that you were using at the time, as far as you know, back in 2010, there was one platform that you know for sure was capable of performing about 90 tests, and that was the TSPU 3.5.
Yes.
Okay. And what were those 90 tests consist of? Like, what category of tests were they?
Proteins, small molecules, antibody tests, generally.
Okay. Are those the same as general chemistry? I think there's serology.
Some of them are serology tests.
Okay.
Some of them are immunology tests. They fall into multiple categories, as defined that way.
All right. And I think we talked a little bit about how at some point, so at first the parties were considering putting the TSPUs in stores, in Walgreens stores.
Yes.
Is that right? And at some point that business model changed. So what, and you might have mentioned this before, but I just want to make sure that we get this right again. So what caused the business model to change? And when did the business model change?
I don't know specifically when it changed. It was the result of continuous engagement with the Walgreens team to address some of the business model concerns that they had and to try to work with regulatory counsel to figure out the right way to do this that led to the decision to pursue what I've been referring to as a phase 1, phase 2 approach.
Okay, so it was because of a regulatory issue that you and Walgreens decided to go to a phase 1, phase 2 approach, where in phase 1 you would resort to a central lab model where samples would be sent to a central lab and processed there. Is that right? And phase 2, the TSPUs would then be put in stores?
Yes, and I don't know if it was only a regulatory issue. There may have been other drivers as well, but certainly working with regulatory counsel was one of the drivers.
And so ultimately, did Theranos roll out its services in Walgreens stores?
We did ultimately with the phase 1, phase 2 model, the clinical lab.
Okay, and when did that happen?
The first patients were served toward the end of 2013.
Okay. And how many stores, what was the maximum number of stores that you were aware Theranos services had been rolled out to?
I think it was 41.
Why did it stop at 41?
We couldn't make the relationship successful beyond that.
Why was that?
I think there were many reasons. The Boots acquisition, the requirements that we had around what we wanted the wellness centers to look like, and then ultimately the issues that we had in our clinical lab and disagreements about the contract.
Okay, so let's go through each one of those. So the Boots acquisition, why was that a limiting factor to the rollout taking place beyond 41 stores?
We had worked really closely with the original Walgreens leadership around the vision for what this partnership could look like. The new leadership had a different vision for what they wanted to do with Walgreens and wanted to reevaluate the contract we'd put in place.
What was the new vision that new management had at Walgreens?
My impression is that the old leadership team was much more focused on healthcare services, and the new leadership team was focused on instituting some of the same services that Boots had employed in the UK.
And what is that?
It was more of a health and beauty focus that they had made really successful in Europe.
How'd you gain that understanding?
I think it's my impression based on conversations with people in the industry and people who are familiar with the Boots leadership team.
I guess, did you have a lot of personal interaction with the Boots leadership team when they came on board?
I have not had a lot of interaction with them.
Who did you understand was leading the Boots team?
I don't know who was leading the Boots team.
And then you mentioned there were some clinical lab issues.
I mean, I know it's very actively involved.
Is this,
Yes.
okay. I think you mentioned also there were some clinical lab issues that came to light. What was that about?
Our lab. We failed in the implementation of our quality systems and our execution, and Walgreens used that as a means to terminate the contract.
Okay, and then I think there was a third factor, which is escaping me right now. So you mentioned
Was it the store setup?
the
Yeah.
store setup. So was that a significant issue in the discussions with Walgreens?
It's my understanding that it was, that specifically we wanted to have effectively a leasing type relationship with them, and that we wanted a certain footprint and a certain build out, like a bathroom near where you're doing the collection. And there was a lot of discussions around the kind of investment that would be required to go into the stores for that.
When were those discussions occurring?
They happened over a period of time, even before the Boots acquisition happened with the old Walgreens management team, and we had believed, based on amendments to our contract, that we were going to proceed with rollout.
Okay, so you mentioned that the parties started discussing a rental model. When did that happen?
I don't know when those discussions started.
Who was involved in those discussions from Theranos?
Sunny Balwani led them.
Did he share whatever discussions he was having with Walgreens with you at that time?
I'm sure we had discussions about it. I don't have memory of specific conversations with him about a rental model, but I'm sure we talked about it.
Okay. And so what was the rental model about?
Once we became a clinical lab, the wellness centers in the stores were our service centers. And so instead of trying to sell devices and cartridges to Walgreens, which was the original concept, now we were effectively just using their space to provide a lab service. And so essentially it was about amending our contract to move to paying them for rent, as opposed to a more integrated model.
Okay, and what did that mean for Theranos? Would Theranos then, of course Theranos would now be paying rent, and where previously Theranos didn't have to pay rent, is that right?
Previously, we would have sold devices and cartridges to Walgreens under the original model.
Previously you would have sold devices and cartridges, so you would be receiving money from Walgreens in exchange for the use of these. And when you say devices, are you
Correct.
talking about the
TSPs.
nanotainers?
TSPUs being placed at Walgreens.
Oh, you're talking about the actual analyzers.
Correct.
Being placed at Walgreens.
Yeah.
Okay, I thought we had been past the phase where the parties were talking about putting the TSPUs in Walgreens, and we were now on the phase 1, phase 2
I'm
business
sorry,
model.
I didn't realize we'd switched to that.
Okay, well, I guess maybe it makes sense. So when did the rental model discussions happen in relation to the phase 1, phase 2 business model?
After
taking
the
shape?
establishment of the phase 1, phase 2 business model.
Okay, so the phase 1, phase 2 model, though, no devices were going to be sold to Walgreens. Is that right?
At least in the first phase.
In the first phase, correct.
Okay,
Yes.
at least in the first phase.
Yeah.
So how was changing it around to the rental model? How was that different from the phase 1 model?
It's the way the economics could have worked in the phase 1 model.
Okay, so in the phase 1 model, were you also charging Walgreens for any of the consumables or the cartridges?
No.
Okay, so how would Theranos be, or how was Theranos generating its revenues from the phase 1 model?
Billing insurance companies and occasionally consumers directly.
And were those revenues split with Walgreens?
We paid Walgreens for the services that they were providing, which is essentially the space and in some occasions labor.
So Walgreens is providing labor for the wellness centers?
Correct.
What labor was that?
In the beginning, it was their technicians for doing finger stick, and then as we began doing venous straws, it was, I think we just used their check-in labor. There may have been other things that they did in the store.
And then when the party started talking about the rental model then, was one of the changes that Theranos would be taking over the labor costs?
My understanding is that we took over the labor when we decided to do venous straws in addition to finger sticks. The rental model was a different way to pay them for the services they were providing.
Okay, so maybe I should ask it in a different way. So how did the economics change between the two models, between phase one and the rental model?
I think that was something that was being negotiated. It was never fully defined.
Okay, were there other costs that you were discussing Theranos would be responsible for under the rental model that Theranos previously wasn't responsible for under phase one?
I don't know.
Was Theranos, were you discussing possibly taking some share of the build-out costs in the rental model?
I think at points in time when we were negotiating with them, we may have offered to do that. But I don't know what our sort of end thinking on the right way to do it was.
Were there any other factors besides the three that we just talked about that led to the rollout being limited to the 41 stores?
I mean, I'm sure there were multiple, factors. As with any business relationship, I think of those three as the first that come to mind sitting here right now.
Did Walgreens have any concerns about the operations of the partnership and the fact that, not enough patients were coming out to the store?
They had concerns after the initial Wall Street Journal articles about our clinical lab. And operations from that perspective, I don't recall discussion about not enough patients. They might have. I don't remember any direct discussions about that.
You don't recall any discussions with Walgreens where Walgreens expressed a concern about the number of patients being too little or too few?
I don't recall any that I was involved in. It's possible that those conversations happened. I don't know.
Did Sunny Palwani ever explain to you that Walgreens was concerned about patient traffic at the 41 stores?
I don't think so. I mean, I know certainly patient traffic was their primary financial driver. I had in my head that they had originally wanted to see something like 10 patients a day, and we ended up in a lot of the stores hitting much more than that.
I guess I'm just trying to understand. You said you don't recall any direct conversations about this kind of patient traffic issue. Do you recall any indirect conversations about the patient traffic issue?
No, I was just trying to say that may have been something that Walgreens talked to him or to others at Theranos about, and I just don't know about it.
So you mentioned that you knew that one of the sort of measures that Walgreens was using was number of patients per day in stores. Is that right?
I was saying that I know that they cared in general about foot traffic. I think that was the value of Theranos to them.
Okay, and you said that they were looking to at least have about 10 patients.
That was the
in
number
store
that
per day?
I had in my head as sort of the goal.
Okay, what was your understanding as to the number of patients per store per day on average Theranos was receiving in Walgreens stores?
I don't know sitting here now exactly what it was. I remember some stores hitting over 40 patients, and I think there's some where there was like 1 or 2, which was part of trying to optimize the retail footprint, because there's some retail locations that just nobody goes to, and there's some that you get a lot of traffic.
Do you recall ever having any discussions with Walgreens about the venous draw percentage that they were seeing in stores?
I don't think I ever had any direct conversations with them about it, but I know that that was something that was discussed between us.
Okay, how do you know that?
Just as I've gone back and tried to look at documents and what happened.
Okay, at the time though, in end of 2013, 2014, did you have any discussions with Mr. Balwani about the fact that Walgreens was concerned about how high the venous draw percentage was in stores?
I don't remember any conversation with Sunny about that. I knew that there were people at Walgreens who cared about how much we were doing on fingerstick. When I had engaged with Walgreens, which was primarily with their executives, and when the Boots team got involved with their U.S. executive, the conversation was largely about foot traffic. So I don't know specifically what interactions happened around the fingerstick percentage.
Okay, I'm going to go through some documents with you. Handing to you what's been marked Fairness Exhibit 206. This is tab 2. Exhibit 206 purports to be a March 29th, 2010 email from to subject line is forward follow-up to our meeting today, with the starting dates number WAG-TH-00006784, with an attached presentation starting at WAG-TH-00006786. Have you seen Exhibit 206 before?
I don't recognize the first sheet.
Okay. Do you recognize the presentation that's attached?
Do you mind if we take a minute to look at it?
Sure.
I don't remember it specifically, but it looks like one of our slide decks.
Okay. And actually, if you head back to the email, the parent email to the attachment, on the second page, bottom of the first page to the second page of the email.
Sorry.
On the
Yes.
first page. At the bottom of the first page is the heading for your email. If you turn back to the first page of the document, at the very bottom, you'll see
Yes.
that there's an email from you with a copy. Do you recognize this email?
I don't, but I don't have any reason to doubt it.
And did you send that email on or about March 23rd, 2010?
I don't know, but I, again, don't have any reason to doubt it.
Okay. So in your email, which is on 6785, the second page of your email,
Yes.
you say, "It was great to meet you. As promised, please find the presentation that we presented today." Do you recall what meeting you were having that day and who it was with?
I don't.
It sounds like attended. Do you know if anyone else did?
I don't remember.
And what role at Walgreens?
I remember him but I know he sort of spearheaded a number of strategic initiatives there.
And what about role? What was his role there?
He was involved, I think, initially with their, and then over time, I think in medical affairs or innovation. I'm not sure.
So do you think that this was around the time of your initial discussions with Walgreens in March 2010?
Again, I don't remember when exactly those conversations started, but that sounds about right.
Okay. If you turn to the presentation, you mentioned that it looked like a Theranos slide deck. With respect to slide decks that you would be presenting on occasions such as this, where you're discussing with a potential business partner certain opportunities, how would you prepare materials to be presented?
So my memory is we generally had a core set of slides that we used based on what the discussion was with different parties, and we would build on that deck. There was a broad range of topics in it, and my memory is we wouldn't actually present these whole decks. You would just present subsections of it based on what we were talking about at the meeting, or use a slide to support a discussion.
Okay, so you think that you might have had this slide deck with you, but you might have only used a portion at the meeting?
Yes.
And you referred to we had the slide deck. Was that you and Mr. Balwani? Or?
So my memory is that internally at Theranos there was sort of one master deck that we would just add content to as the business grew and expanded, and myself, Sunny, and anybody else who needed a deck to support meetings would use certain content from that deck depending on what the meeting was about and what content was needed.
I guess to your knowledge, was there anyone other than yourself and Mr. Balwani who would make these sort of external-facing presentations on behalf of Theranos?
When we were working with pharmaceutical companies, we had a small sales team, and they would create content that I think is in some of these decks and make presentations themselves. Then it's likely that other people within the company would have done the same. I can't sit here with a specific memory of someone.
Do you recall putting together this presentation for that meeting?
I don't.
So do you know who would have put this together?
I don't.
Do you recall Sunny Balwani attending the meeting with you?
You know, I don't know what meeting this was. I know that Sunny was generally involved, I think, in all the meetings that we had at Walgreens at this time, but I'm not sure.
Okay. So if you can turn to 6788. This slide says, in the first bullet point, Theranos' proprietary patented technology runs comprehensive blood tests from a finger stick in real time at the point of care outside of traditional lab settings. What do you mean here by comprehensive blood tests?
I think we were trying to convey that unlike what was on the market for point of care, like a glucose meter that could only run one test on the device, this device was capable of handling a range of tests based on how it was designed.
Okay, so instead of one, it could do several tests.
It could do a whole range.
Okay, by comprehensive, were you trying to convey that it could do all routine lab tests? That a patient could come into or could use Theranos' technology to run a whole range of tests that would otherwise be available through, any commercial lab?
I don't think that's what this specific bullet point was referring to. I think this bullet point was just trying to distinguish the power of having robotics inside a device from a traditional point of care device.
Okay, so maybe I don't understand that now. So what do you mean by this was trying to distinguish between having a robotic device?
So my memory is the way we would introduce our invention was that what was different about the Minilab family was that it was capable, because there was a robot in it, of running a broad range of tests, whereas a glucose meter is only capable of running glucose, right? And what we were trying to do was differentiate from other point of care technology.
Okay, so you weren't talking about the fact that your blood analyzer could conduct many, many tests. It was just that it there was a robotic arm in the machine that could allow that machine to test many tests at the same time?
To test many types of tests, which to our knowledge had never been done in point of care before.
Okay, so test many types of tests, but it sounded when you were gesturing there, and I know I said before not to gesture, but that you were trying to depict a way for a machine to use a robotic arm to perform many tests at the same time. Is that what you were trying to convey by this?
No, just that we had invented technology that could be programmed to do a range of different types of tests, and we thought and think we were the first to do that.
Okay, and so what's the significance of using the robotic arm then?
It's a different architecture that's used in traditional point of care, and it creates versatility with what tests can be run, so you can program it and allow it to perform different steps, just like a tech could in the lab, versus a glucose meter or the point of care devices that were on the market. It's a little strip, and you flow liquid over it, so you could never get it to perform other types of tests.
Okay. And then you go on to note on the same slide, in the third bullet point, our current and past clients include 10 of the top 15 major pharmaceutical companies, mid-sized biopharmas, prominent research institutions in the U.S., and foreign government, health, and military organizations. Do you see that?
I do.
What U.S. governmental health and military organizations were clients of Theranos at this time in 2010?
I think this was referring to the work that was being done with the Institute of Surgical Research in San Antonio, which is the burn study that we talked about. And there may have been others at that time, like Walter Reed. I'm not sure. I can't remember in 2010.
What was Walter Reed?
We had invested in a program, I think around this time, for helping to do diabetes research. I'm not sure exactly when it was or how many of those entities we were working with as of 2010.
Okay, and what about the foreign government, health, and military organizations? What are you referring to there?
I think the foreign government references to modeling work that we had done for people at the IMSS in Mexico for H1N1, and I believe we worked with some health research institutes in Thailand around H1N1 as well.
Okay, and you mentioned, or you state here that there were clients of yours. Did you receive money from them or revenues from them for the work that you performed?
We did from the Institute of Surgical Research. We did not from IMSS or the entities in Thailand.
Okay. And then the fourth bullet point says Theranos is launching Theranos systems to consumers in 2010. What did you mean by that?
What we had talked about with Walgreens to try to do that year, which is take the systems into FDA and try to get CLIA waiver.
Okay, but this is one of the initial presentations that was presented to Walgreens, right? This was in March 2010, so
Yeah.
do you still think you were referring to your relationship with Walgreens when this is one of the initial presentations you're presenting to them?
I don't know. Looking at it now, what it meant then, my read sitting here now is that that was our objective for 2010.
And then turning to 6790. The title of the slide is Overview, Theranos Systems, and there's a picture of the devices. What is this a picture of?
I believe it's a 3 series TSPU. I'm not sure which one.
So are you trying to convey here that the devices that are part of the Theranos systems that Theranos had developed, that was the 3 Series device?
I think we were just trying to show that the Theranos system had a device, a cartridge, and we were investing in a lot of software.
Okay. But this was the device that was part of the Theranos systems that you were hoping to roll out in Walgreens?
I don't think that's what we were trying to convey with this slide. I think we were just trying to convey that the system had multiple components to it. It wasn't just a consumable or a piece of hardware, that there was a lot of software around it.
Okay. And then again on 6791, there's a bigger picture of the device there. What were you trying to convey by including this in the presentation?
I don't remember.
Okay. Turning the page to 6792, the title of the slide is Validation of Theranos Systems. The slide says, Theranos systems have been comprehensively validated over the course of the last 7 years by 10 of the 15 largest pharmaceutical companies. What did you mean by that, and what were you referring to there?
What we've been talking about here today, that we had confidence in our ability to implement this technology based on the experience we'd had with the pharma companies we'd worked with.
Had the pharmaceutical companies validated the Theranos, I guess you say Theranos systems here, did that include the 3 Series analyzer?
Yes.
Okay, and did the pharmaceutical companies validate the 3 Series analyzer during the course of the work that you were performing for
With
them?
the tests that were validated, yes.
Okay, so what do you mean by with the test that they validated?
So the tests that we ran for the different pharma companies that we worked with were on TSPUs. They were on 3 Series TSPUs.
Did you ever give a TSPU device to any of the pharmaceutical companies that you were in contract with so that they could run their own testing on those machines?
Yes.
Which ones did you give the devices to?
This quote here from GSK was one of them. There were others as well. I believe at one point we sent one to the lab at Schering Plough, and the program that we did with Pfizer, the devices were actually in people's homes. I believe with Centicor, I have in my memory that we deployed for them in Belgium at one of their facilities. And I think in a US site as well, but I can't remember. It was multiple instances.
Any other pharmaceutical companies that you recall sending a device to?
I'm just thinking back. I'm not sure. We may have. I know we. I don't know. I'm not sure.
Okay, and then the third bullet point, or the third paragraph on this slide, says Theranos systems are GLP, GCP, and 21 CFR compliant and are validated under FDA ICH guidelines. Do you see that?
I do.
The FDA guidelines, is that the FDA guideline document you were referring to earlier?
I think so.
Okay, and what does it mean when you say Theranos systems are GLP, GCP, and 21 CFR compliant?
I'm not sure. I don't know.
Who drafted this?
I don't know.
Did you ever ask questions about what that meant?
I can't remember at the time. I believe if we were presenting on this slide, would have been confident in it, but I can't remember interactions around it.
And then you go on to say the systems are classified as non-significant risk devices. Regulatory filings are ongoing in preparation for launch to consumers. Do you see that?
I do.
What did that mean to you?
I'm not sure. Sitting here now, I believe the non-significant risk classification was something we had engaged either with the FDA or with regulatory counsel on previously. And I'm assuming this was reflecting the fact that we thought we were going to take the technology into FDA to try to get clearance and CLIA waiver.
Were you involved in those FDA discussions previously?
I don't think at this time I had been directly involved with the FDA.
Okay, so you just mentioned that there was some classification of the device as non-significant risk
Yeah.
in connection with discussions with FDA.
It was either with FDA or with outside counsel or regulatory advisors that we'd had. I don't know which one.
And then you say regulatory filings are ongoing in preparation for launch to consumers. So which regulatory filings were you referring to there?
I don't know.
Okay, let's turn to 6799. The title of the slide is Theranos Systems Products, and there are 3 categories of tests there. There's general chemistry tests, wellness tests, and diagnostic and predictive women's and men's health tests. So the general chemistry tests, were those part of the 90 that could be conducted on the TSPU 3.5?
So I was, just as I was flipping through it, looking at another slide here where I read it as being related to sort of a set of standardized tests that could be run at retail. So I'm not sure. I'm not sure specifically what we meant by general chemistry at that time.
What were you trying to convey from this slide?
I don't know then. Sitting here now, my read on it is that we were saying this is what we wanted to try to do with whoever we partnered with at retail to bring to consumers.
So you think that these were the tests that you had told Walgreens that you were trying to achieve on the TSPU?
No, I think that this is, and if I remember it with Walgreens right, we had sort of designed a multi-phased model in which we would start with routine testing if we were going to put the device at Walgreens, and then over time ultimately do what we were referring to as predictive tests. So I think this was sort of the vision for what we would want to do with the TSPU at retail.
Okay. And then if we turn to 6803 and 04. So you've got some Theranos pricing here for various tests. And you just said that you were hoping to be able to develop the test to be able to be used in clinical testing. Is that right?
Generally, yes. I mean, we'd obviously deployed some tests for pharma companies and had others that we'd already developed, but again, as these had not been into the FDA yet.
Were these tests already developed on the TSPU? The ones on these 2 pages?
On the pricing list?
Yes.
I think these were just slides on the kind of business model that you could have with representative tests. I don't know what the status of these assays was.
Okay. So why would you have pricing if these were tests that were supposed to be representative tests that may or may not have been developed at the time?
Because we were, I'm reading this now, my interpretation is we were trying to convey that there could be a really good business in competing with other labs like Quest that charged much higher prices for lab tests.
Okay, but how would you know what price you'd be able to offer those tests for if you hadn't developed the tests yet?
So, I mean, again, I don't remember this deck or the meeting, but reading it now, my understanding of this kind of content is we were saying we want to try to bring these devices to retail. We make them ourselves, we make the cartridge ourselves, we make the chemistry ourselves. This is the kind of business that we think we could create with it.
Okay, and so how did you come up with these numbers then if you weren't sure if the tests had been developed yet?
I don't know.
Is it fair to say that this theme of reduced cost testing was whether or not you remember it in the context of this particular Walgreens meeting, that remained a constant throughout your discussions with Walgreens. Is that fair?
Absolutely.
And that was true even after you sort of switched to the phase 1, phase 2 approach. Is that?
Yes.
Did Theranos sort of consider the pricing it was offering customers in light of its switch to using modified third-party devices?
I don't know. I don't know.
I guess, do you recall doing any sort of analysis about whether Theranos could, I guess, sustainably offer, cheaper tests under the model that it was operating in the retail pharmacy in late 2013 or 2014?
Yeah, I wouldn't have been the person that would have done that, but I believed, based on my ongoing conversations with Sunny, that we thought it could be a financially viable model, and in fact, a better model than if you tried to use TSPUs in a centralized setting, because you'd need so many devices since they could only process one at a time.
Okay. Then turning to 6810. The title of the slide is Real-Time Fingerstick-Based Tests for Launch at Walgreens in 2010. And there are 3 categories of tests. There's general chemistry panels and standard blood tests, influenza, and fertility. Were all of those tests being performed, or were those tests capable of being performed on the TSPU 3.5 at this time?
So again, I don't know what exactly we were referring to as general chemistry. I believe yes, as to influenza and fertility.
Okay, so all of these tests could be run on the TSPU 3.5 in 2010.
Again, yes, as to influenza and fertility. I don't know what we meant by general chemistry at that time.
Who would know? Somebody put together this presentation and you ended up sending it to Walgreens. Who would know what you were talking about in these slides?
We could look back and try to piece it together. Maybe Sunny, I don't know.
And was it your practice to be sending materials to people where you weren't sure of the information that was being presented in the materials?
I don't think so.
So did you review this presentation prior to sending it to Walgreens?
I don't know. It was a long time ago.
Do you think, based on your practice in your business, that you would have reviewed the materials prior to sending it to Walgreens?
I think that we would have had a deck that was an amalgamation of slides that we shared very openly with people. I don't know that we would have reviewed the whole deck before we sent it out at that time.
Okay. And if you saw something in the slide deck that you weren't sure of, or that you weren't as familiar with, would you have asked questions about it and wondered why it was being included?
Yes.
And have you done that before?
On a slide deck?
Yes.
I can't sit here with a specific memory of that now, but I'm sure I have. On any content that I'm engaging in.
Okay, you can put that one aside. I'm handing to you what's been marked Theranos Exhibit 209.
207.
Oh, I'm sorry. It's 207. No, 207. Oops. Exhibit 207 purports to be a May 7th, 2010 email from Elizabeth Holmes with a copy to Sunny Balwani. Subject line is regulatory overview summary with starting Bates number THPFM 0000416-490 with an attachment with Bates number ending 416492. Have you seen Exhibit 207 before?
I don't remember it, but I don't have reason to doubt this email.
Did you draft and send Exhibit 207 on or about May 7th, 2010?
I don't know, but again, I don't have reason to doubt it.
So you mentioned in this email that you're attaching a document as requested. What did request?
I don't know.
If you look at the attachment, the title is Regulatory Summary. Do you remember discussions with him about Theranos' regulatory strategy?
I know there were a lot of discussions with Walgreens about our regulatory strategy. I don't have memory of specific discussions about it, but I know it was something we were actively engaged with Walgreens on.
So, and as you look back at this attachment, do you recall who put this together?
I don't.
Did you put it together?
Do you mind if I take a minute to read it?
Sure.
I'm not sure. I don't know. I don't recognize some of the content in it. I'm not sure.
If you didn't write this document, who would have written it?
I believe we were actively engaged with regulatory counsel and advisors during this period, including on helping us figure out how best to communicate with Walgreens on our regulatory strategy.
So you think it could have been regulatory counsel that put this information together for you?
I don't know. It has reference to words I don't recognize, so I'm not quite sure where the content came from.
Who was your regulatory counsel at this time?
It's 2010. We may have been working with FDA, who was an FDA expert, and I don't know if we'd yet engaged. May have been later, but I think this time.
Okay, so if you look at the document, in the first paragraph it says Theranos systems were first reviewed by FDA in 2005. At that time, FDA determined that Theranos systems were classified as non-significant risk devices and non-invasive, and therefore did not require an IDE under this particular regulation. Do you see that?
I do.
What discussions did Theranos have with FDA in 2005?
I believe this is referring to a meeting our team did to determine the classification of the devices for clinical studies with pharma partners.
Who was involved at that meeting?
I don't know everyone. I believe who worked for us at the time was a part of or led it. I know there was multiple people from Theranos. I don't know who else was there.
And what did FDA review at that time to make this determination that it was a non-significant risk device?
I don't know.
Were you at that meeting?
No.
Were you involved at all in the preparation for that meeting?
I don't know.
Was at that meeting?
In 2005?
Yes.
I don't think we started working with them until much later.
So I'm trying to bridge who would have had knowledge of that and who would have been writing this document. So who do you think would have given you or whoever drafted this document information about a 2005 meeting?
I don't know. I could speculate that there was some documentation from this meeting that this language was taken from, because it's very specific, but I don't know where it came from.
Okay. So let's move on to the fourth paragraph down, starting with assays. Do you see that?
I do.
Okay, so it says assays on Theranos systems were validated for a broad range of tests, including PK assays, PD assays, and general chemistries. What are PK assays?
Pharmacokinetic assays.
Okay, what are those?
They're generally used to measure drug levels or metabolites of drugs.
Okay, and what about PD assays?
Pharmacodynamic assays.
And what are those tests?
Tests that look at the efficacy of a drug or the safety of a drug.
Could Theranos' TSPU perform all three of these tests, general chemistries, PK assays, and PD assays?
Yes.
And then the next sentence after that, it says, after receiving endorsement from FDA. Do you see that?
I do.
What endorsement do you understand Theranos received from FDA?
I don't know. Reading this now, I can infer this is about pharmaceutical partners talking to the FDA about use of our systems in their studies, but I'm not sure.
I'm sorry, and so you're saying you can infer that this was pharmaceutical partners talking to FDA?
I think so, but I'm speculating. I'm not sure what exactly it's referring to.
So how does that amount to an endorsement from the FDA?
Again, I'm not sure what it's referring to. Sitting here now, I read it as meaning that we believed we had blessing to use these types of systems in clinical trials for data generation that would then be submitted to FDA by pharma companies for their studies.
Okay, and then focusing now at the second to last paragraph of the document, starting Theranos is confirmed. Do you see that? It says Theranos is confirmed with regulatory authorities that the 510K in the US and CE mark in Europe are not required for the systems to be used as the sole platform for data collection and analytics, including for all blood sample processing in registrational clinical studies or in certified laboratory settings. Do you see that?
I do.
Which regulatory authorities are you talking about here?
Again, I don't know specifically. Sitting here now, believe this is referring to the discussions with the pharma partners about what regulatory certifications would be needed for data collection in clinical studies.
Okay, but it says Theranos is confirmed with regulatory authorities, so this wouldn't have been a confirmation with your pharmaceutical partners. Do you recall any discussions with regulatory authorities about this?
I don't. Again, I believe that both through Theranos' early interaction with the FDA and through its engagement with pharma companies, we understood that the device did not need these certifications for use in pharmaceutical clinical trials.
Okay, you can put that on the side.
Why don't we take a short break if you're moving on to a different document?
Sure. We're off the record at 5:15 p.m.
We are back on the record at 5:27.
Ms. Holmes, did you have any substantive conversations with the SEC staff during the break?
I did not.
I'm handing to you what's been previously marked as Theranos Exhibit 44. Theranos Exhibit 44 purports to be a document titled Theranos Master Purchase Agreement dated July 30th, 2010, with starting dates number WAG-TH-00000006. That's 7 zeros and a 6. Have you seen Exhibit 44 before?
I recognize it as what I believe is our original contract with Walgreens.
And did you review and sign Exhibit 44 on or about July 30th, 2010?
I don't remember exactly when I signed it, but I see my signature here and know that I did.
So this is your signature that you're seeing on page 7?
Yes.
Okay. If you turn to the page with base number ending 8, which is the next page, this is a Schedule A to the agreement called Program Overview. And under background, it says Theranos has developed and is developing generations of mini lab devices that can run any blood test in real time for less than the traditional cost of central lab tests. And then there's a picture of a device on the right. Is that a picture of the mini lab device?
The 3 series version of it, I believe.
Okay. Okay, actually, you can actually set that one aside. Handing to you what's been marked Theranos Exhibit 208.
Thank you.
Exhibit 208 purports to be an email from Elizabeth Holmes with a copy to Sunny Balwani. Subject line is Forward Hopkins, with starting dates number THPFM 000-562-0882. And there's an attachment with dates number ending 562-0883. Have you seen Exhibit 208 before?
I don't remember it, but I see it as an email, forwarding an email.
And did you draft and send Exhibit 208 on or about September 10th, 2010?
Again, I don't have memory of it, but I don't have any reason to doubt it.
Well, wait, can we just clear something up? When you say 208, you mean the first page of 208? Because there's an attachment to it. Are you asking her if she drafted the attachment too?
Oh, I'm actually asking if she drafted I'm sorry, you're right. Okay, so did you draft the email that came with the attachment?
Just the first
On
page is
Exhibit
asking about.
208?
Got it. Yeah, I assume I did. I don't remember it, but I don't have reason to doubt this chain.
But you assume you drafted the email?
Yes, not the
Okay.
attachment. Thank you.
Right.
Sorry.
And did you send the email with the attachment then on or about September 10th, 2010?
I believe so, based on this email.
So what is this email and the attachment about?
What is the attachment about?
Yes, or what are the circumstances for which you sent this email to?
I don't know what the circumstances were. I read from looking at it right now that I was just forwarding what I'd gotten from Walgreens.
And if you do turn to the attachment then, the attachment is titled Summary of Hopkins-Walgreens Theranos Meeting, April 27th, 2010. Do you recall attending that meeting?
I do.
Who else attended with you?
I see the attendees here and don't have any reason to doubt this list.
Okay, so do you think that, do you recall Sunny Balwani attending that meeting with you?
I do.
And in terms of the attendee list on the first page of these meeting minutes, is this an accurate reflection of who would have attended that meeting?
I believe so. I don't remember all of them, but I believe this is accurate.
What was the purpose of this meeting?
Walgreens asked us to go to Johns Hopkins to talk about what we'd invented.
Do you remember attending the meeting?
I remember, I remember being there.
So you think that's just
I think so. Yeah. And then I recognize the other names and have general memories of others being there.
What happened at this meeting?
We presented essentially the architecture of what we had invented, and the Hopkins team asked questions about it, and I believe looked at some of the data on the chemistries that we had at that time.
And what did Hopkins do after the meeting?
I don't know.
Did you ever present to Hopkins a device so that they could run their own tests on the device?
We brought a TSPU to this meeting, and I believe they did, or we did, run something on it in that meeting. I'm not sure about that, but I think we did. And then later we just gave the device to Walgreens to run at their site in Chicago.
What was your understanding as to why Walgreens was including Johns Hopkins at this meeting?
I don't know. My guess is that they were asking Hopkins to assess the invention.
Okay, and if you go to the page, flip the page to 884, there's a number of key findings here. What was your understanding as to what these key findings were based on?
The meeting that we had, the discussion that we had during that meeting, I think some of the data on the chemistries that we looked at, but mostly the architecture of the invention.
And how long was the meeting?
I don't know.
Do you know if it was a full day, a half a day, an hour?
I'm guessing. I think about half a day, at least half a day. It might have been a whole day. I'm not sure.
And did Theranos ever enter into any relationship with Johns Hopkins?
I don't think Theranos did formally. I know Walgreens had one.
Okay. Was Theranos ever in discussions with Johns Hopkins to enter into a relationship?
I'm not sure. I think we might have been at different points in time at Walgreens' urging, but I don't think we ever did.
Okay, so in terms of Johns Hopkins, access or interactions with your device, would that have taken place just at this meeting then, or were there other opportunities in which they had a chance to review your device and data?
I don't know. I know that Walgreens had many interactions with them. I don't know what they shared.
Okay, but in terms of your interactions with Johns Hopkins, would that have just been this one meeting with them?
So we had previously known, we were asked to do this meeting by Walgreens. Later, after we had the partnership in place with Walgreens, there were further interactions with Hopkins, and then even later with some of the Hopkins team as I worked to build out scientific and medical advisory boards.
At any of those interactions with her, those conversations that you were just referring to, did you present any additional data to them on Theranos' analyzers?
So I don't know what had seen before this. I know he was engaged with some people who were working with Theranos. I don't know in the course of the Walgreens relationship what additional data Hopkins had access to. I know that was involved as I was working to build out the scientific and medical advisory board, I think in early 2016, and he saw a lot of Theranos data in that context.
Okay, so that was in 2016.
Yeah.
Do you know as of, I guess, 2010 to 2014, whether there were any other discussions with, or did you have any other discussions with Johns Hopkins about Theranos' analyzers or the data underlying those devices?
I don't know if it was in that time period. I believe at one point Walgreens came with the person who was doing pediatric testing at Hopkins to talk about what generally the small sample assays could mean for pediatric testing, and we did not have bandwidth to follow up on focusing on that relationship and didn't. But other than that, I don't know of any specific interactions. I wouldn't be surprised if there were more, but I don't think I was involved personally in any of them.
When did the meeting with the pediatric person take place?
Again, I don't know specifically when. I don't know. It may have been around the 2014 timeframe, but it could have been 2015. I'm not sure.
Did you present data to that person during the meeting?
I don't know.
Was there any follow-up after this meeting in April of 2010 between Theranos and Johns Hopkins?
I don't think there was direct engagement with Theranos. I know Walgreens had follow-up with them.
And did Walgreens ever relay what those discussions were about to you?
I don't think so, at least not to my knowledge.
You can put that one aside. I think we have no further questions for today, so we will be adjourning until Thursday, July 13th, 2017. And you understand that you're still under subpoena
I do.
to appear for that date.
Yes.
I think we are off the record at 5:40 p.m.
This concludes media number 4 and volume 1 of Elizabeth Holmes.
So should we